Hello, good afternoon, beautiful people. How was today's service? You are welcome again to live on Facebook with Nurse Oke. Today we would have discussed, last week we were able to discuss what I call sex is good, where we were able to educate ourselves about the importance of sex, the way to go about it, exploring your body, leave pretenses out of it and enjoy it. That is good. But this afternoon, we shall be starting the series of I call sex complication, the effect of sex, what are the things that can lead to, that can make someone to resent sex or resent their partner. So we are going to take that maybe like 3-4 weeks so that we'll be able to trash it very well, to encourage people if you have questions, if you have any challenges, so that we can discuss it. So today we are going to start on the one talking about the male problems when it comes to sex. Maybe by the time we'll be through 3-4 weeks, we'll be able to move on to the next one, which is discussing the female part. But today we are going to start with the male part, and the title for today's topic is Premature Ejaculation. I say premature ejaculation. What do I mean? Or what do we mean when we are saying premature ejaculation? Premature ejaculation has to do with an inability of a partner to satisfy the spouse or the partner due to certain reasons that are beyond this or our control. We all aspire to satisfy our spouses, as partner, but when you are not able to do such as a man and you have premature ejaculation, when you are having premature ejaculation, it's simply when you are not able to last for like more than 1 second, or you are able to last for below 1 second, 1 minute rather. Even your partner is, has not even gotten to the point of enjoying it. She's not ready to go all the way out. That okay, I've had sex, I've had good sex, and you are releasing on time. So it is a premature ejaculation when you are not able to sustain an erection, when you are not able to penetrate and stay as long as maybe minimum of 3 to 5 minutes. So it is called premature ejaculation, and 30% of men have been noticed, according to research, that have been going through this maybe once in their lifetime, or most of their times they have been known to go through to experience premature ejaculation. And when you talk about premature ejaculation, it has a lot of problems associated with it. So when we are talking about premature ejaculation, it has a lot of causes. There are basically 2 types. There is the primary premature ejaculation. That is maybe as a younger person, as a younger guy, you are just being introduced gradually to sex, and you are having challenges, you are having wet dreams. By the time you want to meet with a girl or a lady, you are not able to have a sustained erection. That's primary. You are just starting. You are not experienced about sex, so you just want to try. So that is premature. That is the primary part of premature ejaculation. Then we have the secondary, which is also called acquired. Maybe over time there is a problem that happens to you along the line, and you are not able to maintain a standard erection with your partner. A copulation that is more than 3 to 5 minutes. You are not able to achieve that. It is acquired. And what are the causes? What do we think are the causes? We look around us today. There are a lot of things, but basically we are going to be discussing in other 3 main causes. And the first one is physical. Your physical build. Maybe you are anxious. You are having anxiety. How do I satisfy my partner? You are overwhelmed with the thought of being too anxious. Maybe it's your first time with this lady or something. Then you might not be able to meet with your woman the way you are supposed to meet with her, because of anxiety. Perhaps maybe you have been sexually abused as a child. or you have been abused as an adult, and the trauma remains with you. You are not able to let go of the past. Your brain, your body, your physical body, your being is not able to, leave those trauma. You are not able. Maybe you have not been given a good counsel. Maybe you have decided not to speak up, because most of us, when we have problem, we believe, I don't want people to make jest of me. I don't want this. I don't want that. And what do? We pent up all those anger. So that physical condition, maybe you are going through health challenges like diabetes. Some people, if they are having challenges like diabetes, hypertension, they have low libido. Apart from low libido, they are not able to sustain an ejaculation, a good sex for a longer period of time. Then under the physical conditions too, some people, if they are hypertensive, there are some drugs for diabetic patient, kidney, long-term kidney disorders patient, liver failure, heart failure, a lot of disease, hypertension. There are some drugs that the doctor recommend that makes your libido to be very, very low. And when the libido is low, even the interest will not be there to even start something, to initiate sex, not to talk of enjoying the sex or being able to sustain a longer time, to last longer in bed with your partner. So under the physical, those are the major things. Then when we are talking about the biological, there are some hormones in our brain. They are called neurotransmitters, and it's one of the catalysts of sex. It propels sex. So one of these hormones, what happens if it's not adequate in your system? One of them is serotonin. If it's not adequate in your system as a man or as a woman, what happens? You will have low libido. There might be frigidity. We are still going to discuss about women. Like I told you, you will not be able to have a sustained erection and meet with your partner. Then, apart from the biological, then there are some things, and the body, the testosterone is the male sex hormone. If it's not adequate in your blood system as a man, you might not be able to have a sustainable erection. You might not be able to have a sustainable sex and be able to satisfy your partner. You are going to be releasing faster than you think, or faster than your partner wants you to release. So those are under the biological. Then the psychological, like I said, stress. You might be going through stress as a man, maybe financial stress. Maybe there is no peace in the house. The wife is the nagging type. You have your own family issues, extended family, immediate family, siblings, and all that. If you have a lot of stress, even if you are going through stress at work, and the wife does not even want to understand that the wife might be able to understand, but you are not ready to open up. What happens is it might affect your libido. It might affect you, and you come down to having premature ejaculation. So these are many more that the things that can cause it. We have the biological, like I said, we have the physical, and we have the psychological. Psychological, maybe you have been abused, like I said, as a child, and it has remained part of you. Maybe you are depressed. You have some issues that you are not taking to anybody. You are going towards depression. You have left the standard way, the optimal point between health and wellness is gradually leaving you. You are going towards the negative side, which is sickness, which is illness. And if you are going towards that, you are having depression and you are not talking to somebody, you are not going for any counseling, no therapy, nothing, you might be depressed. And at the end of the day, if your partner does not know that you are going through certain things, you might want to release on time. And these are the problems that we are having in marriages today. They are the problems we are having in homes today. That people, we are not able to express ourselves. We are not able to tell, how do I feel about you? How do I feel when you're making love to me? How do I feel when it is time for sex? And it is gradually breaking a lot of homes. And what we are saying is that marriage is a relationship, particularly marriage, the family is what makes up the community. Like we said last week, the community makes up the whole nation, and the nation makes up, every nation makes up the whole world. And charity begins at home. What you don't have, what you cannot give at home, is not possible for you to give it outside. So what we are saying is that we want to reduce, want to remove the problems. We want to at least reduce the problems that are associated with sex. Whether you want to believe it's an integral part of our life, and it's very, very, very essential. Nobody will tell you that because of this relationship I don't need sex. I'm just there for companionship. No, yeah, it might be part of the reasons, but one of the main reasons is sex, and it has to be done. If it's going to be done, it has to be well, not how far, not how long. So, having known, when you're able to know what are the challenges that comes along with premature ejaculation, I think we'll be able to discuss it. Maybe you are worried, maybe because you have had it 2-3 days ago with your partner and she was disappointed because you were not able to give her a sustainable time, a nice time, a pleasurable time when it comes to sex, and you want to, she's resenting you, and you are worried that how do I satisfy her? How do I satisfy? Even putting that worrying in your own system might affect your own libido, thereby making you not to be productive by giving her a good sex when it is necessary. Then under the psychological, we have the erectile dysfunction. The erectile dysfunction is when the penis, now the phallus, is not able to at least erect. The penis is supposed to stand erect, but this time around it's not able to stand erect at all. What happens is that you are not able to make, you won't even be able to penetrate into the vagina because there is no strength, there is no turgidity, no strongness in the penis. So those are several reasons that that can cause what we call premature ejaculation. And we have discussed it that it has primary and it also acquired. Just like primary when you are just starting, then the acquired is when you are just there. You have been having it, maybe due to one challenges, one reason or the other, maybe out of all these numerous reasons we have enumerated, you are not able to continue, maybe due to health challenges. And what happens? Now, when you're having it, it's not the end of the world. It's not a death sentence. I want you to know that premature ejaculation is treatable, both manually, and it can be treated medically, and it can be treated surgically, depending on the cause. There's some, we have a retrograde ejaculation, where the spermatozoa being released is going towards the back of the bladder instead of going towards the urethra into the vagina. It's not going to come directly, and some even is one of the problems of infertility. So what do we say? We are talking that everything they can be treated. That's just the basic. You don't have to, because of that, run away from sex. You don't have to, because of that, abandon your partner in the house. You don't have to, because of premature ejaculation, do what is not. Like in this part of the world that I'm used to, a lot of us, because of premature ejaculation, we use all manners of, we take all manners of concoction, all manners of hot drinks, all manners of wine, all manners of, I cannot just, the resultant effect, we just go to our liver, our kidney to paralyze them. And you see people coming down with kidney disorder every day, because all in the name, because they want to satisfy their partner. Here, most part of the world is unheard of that I cannot satisfy my partner sexually. It's unheard of. We are ashamed to say it. We are shy to discuss with people. But if you are able to talk out, you just have to expose yourself. Open it up. There are thousands of sexual therapists there. There are thousands of relationship counselors that you can talk to. What will they do? That will help you. So, like I said, the treatment is divided into several ways. Like we have the manual treatment. One of the manual treatments is masturbation. Masturbation is when you are able to stimulate yourself to release, to ejaculate on your own, and maybe through the help of your partner, or maybe by yourself, you are able to masturbate and release. So when you want to treat premature ejaculation sexually, manually, when your partner is with you, you know you are ready for sex. In an hour or two, you can help your spouse as a woman. In an hour or two before the real thing, which is the copulation, you allow the man, you make him come through through masturbation, or the man himself can do it in your presence. You assist yourself. You know, there shouldn't be any shame. There shouldn't be any shyness when you are with your partner. It has to be all bare, no hold back. No, nothing. No, you do not hold anything back. So you after the masturbation, like 1 or 2 hours, the man is more relaxed, and when the real action comes, he's able to have a sustainable time to really satisfy you as the woman. Those are part of the manual treatment we are talking about. Then apart from that, what can you do again? You can stimulate the tip of the penis. The glans penis, just that area, you stimulate, you hold, you stimulate, you hold. You make sure the man is relaxed, is enjoying it, and when he's about to ejaculate, you stop. You stop the stimulation, so that the ejaculate will not come out. You are able to hold on for a sustainable period of time. You can assist the man. The man can do it himself. So by the time he has, you can try 3-4 times. By the time you are able to do that, what have you achieved? What you achieve is, assisting your partner to at least have a sustainable erection. Apart from that, there are some condoms under the manual treatment that have been specifically manufactured for the purpose of these ones. We won't be mentioning name. We are not advertising for anybody, but there are some condoms, there are some durecies, that are specifically made for these purposes. There are some things like a topical anesthetic agent that has been added into the condoms, so that when the partner puts on the condom, it reduces the sensitivity. It reduces the sensitive feeling that the man is having, and when there is reduction in the sensitivity, it will be able to last more than that 1 minute until he is able to satisfy you. There are a lot of condoms like that. Those are the way they made them. Those are the way they made them. Those are the purposes for which they are made. Then under the manual treatment, we have what we call pelvic floor muscles exercises. There are sometimes the pelvic muscles, they are weak, maybe due to hormone, maybe due to any sickness or anything in the body, illness, long-term diseases like diabetes, like hypertension, all those ones. Over a long time, the pelvic muscles are no longer strong enough. So what do we do? There are some exercises we call Kegel exercises. Even women post-birth, post-childbirth, they are advised to do it because it's very, very good for the pelvic muscles. So when you are placed on these Kegel exercises and you do it religiously in 2-3 weeks, the muscles of the pelvic will get stronger. There will be strength. It will be the exercises will strengthen the muscle, thereby assisting you to be able to have a sustainable erection and be able to satisfy your partner without ejaculating prematurely. So those are the squeeze and touch technique. Like I said, you squeeze it, you squeeze the head of the penny, you hold on like that. Pulse and squeeze technique. A lot of manual treatment that are on ground for somebody to, they call them behavioral techniques. They call them. So most of the time when we want to treat on this, what do? We involve the partner. It's not about you because I'm having a premature ejaculation. Already the partner is hurting at home. Already somebody or the wife or something is not happy with the circumstances at home. So we involve both of them, both parties, so that the wife will be counseled. The wife will be enlightened on how to go about it. Not nagging, not having problem or resentment towards your partner. So those are the ways we think we can we are managing it manually. Then under the manual treatment, we have medications too. there are a lot of medication. We have the topical medication. We have spray. Those one are analgesic agent like lidocaine. They are made specifically for these purposes. Like topical, when we treat with it, you are spraying it maybe like 10 to 15 minutes prior sexual intercourse. And what does it do? It helps. It assists you in having a sustainable erection when you're able to at least spray all this topical stuff 10 to 15 minutes prior to that time. It helps so that you're able to have a sustainable time. You won't release before the normal time. So there are other medications or analgesia, a lot of treatment that are used for all these things like antidepressant, depending on the when the doctor wants to treat, when we want to treat, we take into cognizance that we must have asked what were your the medical history. Maybe you have any health conditions, maybe health-related issues, maybe you are going through psychological stress, maybe you are anxious, maybe the partner, maybe at work, so that by the time the treatment is going to commence, it's going to be total. It can be two or more, three. It can be one or two, or even three treatment at the same time. You can mix with the physical, can go with the medication, and if we are not satisfied with it, we still go with counseling. Especially when you are depressed, or when you are when you have gone through, when you are a victim, when you have been a victim of sexual abuse, when you are worried, we are able to. You can go through this treatment, which will be total, the totality of it, the nitty-gritty. That is the physical, the manual, the psychological encouragement with the medication, so that you will come out fine. So what are we talking about? Talking about premature ejaculation is not a death sentence. It's not something that cannot be taken care of. Premature ejaculation, apart from all these treatments, there is counseling. There are various sex therapists out there you can talk to. If you don't have anyone, you can talk to us. Our number will be left after this time out for any health challenges. Even apart from this one, we had wanted to talk about bedwetting today, but due to popular demand, my people said we should discuss first about sex. Since we did sex is good last week, that we should let us know what are the problems. How do we go about resolving all these things that are posing grievous challenges to our relationships, to our marriage? It's not about sleeping with a woman, spending 1 second, and you say, she has enjoying it, I'm giving it to her. No. If you're having premature ejaculation, the whole relationship, the partner will have resentment towards you. She might not even want to answer you when you say it is time, because she knows number one, you are not ready to listen, and number two, you are not going to have a sustainable erection to be able to satisfy her. So anything less than 1 minute, anything more than a minute, that is not up to 3 minutes or minimum of 5 minutes, is premature ejaculation. So apart from all these things, you need a counselor, you need a therapist to talk to, and there are various vitamins that can be used to boost your sperm, to boost your sexual life. So it's not all about concussions, it's not all about hot drinks, it's not all about various kinds of things that we mix up in this part of the country, in this part of the world, that we believe at the end of the day, and the effects and the complications thereafter are so many that even the health sector cannot cope with. It's overwhelming. When you tune into your TV every day, you see people coming down with kidney disorders. We have been in this country the last 15, 20 years, more than 20 something years ago. There were no issues like that. Even if they were very, very as in minimum. But now it's an alarming rate, because we don't know what it means to care for our kidney. We don't know what it means to care for our liver. We don't know what it means to care for our heart. We do all manners of junks. We fixing into our body all manners of junks. So if you're having premature ejaculation, my brother, please talk to us, or you get your doctor, get your counselor. Make sure you are properly diagnosed first. not about Ogogoro, not about Chelsea and all that. Talk to your counselor, talk to your doctor, let them know this is where I'm coming from. Your medical history is very, very paramount before you start taking in anything as self-medication. When your history is done, they will be able to diagnose you properly. After diagnosing properly, they will be able to direct you the kind of care that suits you. The kind of care that suits me might not suit my next person. It might not suit the third person. So that you'll be able to be given an holistic care. An holistic care when you are being monitored in all aspects of your health. Not only the drugs now that we so much believe in here. It can be preventive. It can be, counseling, So that's the more reason you have to visit your doctor. You don't go about drinking all manner, or because somebody said it has worked for me and you want to try it. So if you have any question, our number, like I said, is 080-512-94235, 080-5129-4235. If you are not able to get the number, you can inbox me. Whatever challenges you have, we are here to always help ourselves out. And I know as we continue this new week, it is going to be well with each and every one of us. Come your way next Sunday. I remain Nurse Oke. Have a nice week and bye-bye for now. Thank you.